There are calls for more research into tongue cancer as there's been a rise in the number of younger people with the disease. A mouth surgeon at the Norfolk and Norwich Hospital says a lack of dentists could be one of the reasons for the increase. A warning, Debbie Tubby's report is filmed in an operating theatre.
2, 3, 4 and 5, and I'll take some 12s as well, please.
It's 9:30 in the morning. They're prepping the theatre for Deborah Horsley, who's about to have her 8th operation. It's the 4th time she's had cancer in her mouth after finding an ulcer on her tongue 14 years ago.
It's taken over my life, really. Things like blowing raspberries to my grandson and stuff like that. God, I'm going to cry.
She's already had her tongue rebuilt. Now the surgical team are hoping to remove the cancer that's been found in her gum.
My life's in their hands, so, you know, but they've looked after me.
The operation is expected to take 1.5 hours.
This here is what we call a reconstruction, and it's come from her left forearm. This is the area of concern.
And the plan is to excise that tumour and see how extensive the cancer is.
Registrar Sarah Jane Miles is training to be a surgeon a year after she was diagnosed with tongue cancer.
I think it gave me a sort of different way of looking at things from a patient perspective as well. So obviously I have the medical training, but it's different when you're going through things yourself.
It used to be older drinkers and smokers who were diagnosed with this kind of cancer. Now they're seeing an increase in patients in their 20s to 40s.
Maybe there's some genetic factors, but there could be a whole host of reasons. Certainly not being able to see dentists, not being able to see primary care could be an issue for a lot of patients, and certainly it's something that we would like to see corrected.
Barbara Fountain was just 32 when she was diagnosed with tongue cancer on New Year's Eve 5 years ago.
I looked at my now husband and fiance's face, and it was like shattered glass, and I could just see like his world just completely turned upside down.
She had a 12-hour operation to remove a quarter of her tongue, rebuilt using parts of her arm.
And just stick your tongue right out.
Today she's having a check-up. She's now set up a charity for youngsters and a support group for their loved ones.
We need money invested to find out why this increase has happened and what is driving it, so we don't end up with a tongue cancer crisis in 10-20 years' time to come.
Back in theatre, surgery has been halted. It's bad news. Deborah Horsley's scans didn't show the extent of her cancer.
What's become obvious is that the underlying bone is involved, so therefore we'll need to inform the patient about the progression of the disease and the fact that she's going to need further surgery.
Her lower jaw needs removing. She may need radiotherapy, but they need to discuss it with Deborah Horsley, who wanted us to tell her story in the hope that it could save other people's lives. Debbie Tubby, BBC Look East, Norfolk.
Well, our health correspondent Nikki Fox is here. And Nikki, I mean, so brave of Deborah to allow us to show that, given how the operation turned out.
Yeah, especially as you saw there, they did have to stop the operation, but she is so keen to highlight this issue. And that's because Cancer Research UK, based in Cambridge, says that people are being diagnosed younger. In fact, over the past 10 years, there's been a 13% increase of people in their 40s being diagnosed with mouth cancer. Now, the surgeon that you saw in that report, Richard James, thinks the fact that people can't see their dentists or doctors plays a part, but the reality is we just don't know.
And Barbara Fountain said that, that there'll be a crisis if there isn't more money put into research. What does the Department of Health say?
Well, we asked them, and they say that they're spending £1 billion a year on researching a wide range of cancers. They say it is being detected earlier and survival rates are improving, although they're nowhere near as good as they are elsewhere in Europe. Now, with regard to the shortage of NHS dentists, which we've talked so much about, they say that people are receiving more NHS care. And as far as Deborah Horsley goes, she is having a further operation later on this month, and we hope to follow her journey.
Thank you very much, Nikki.